Hello friends, let's study our topic pectoral region muscles. Mainly there are three muscles included in the pectoral region, but serratus anterior muscle is also studied with these muscles. In this lecture, total we study four type of muscle. Pectoralis major muscle, pectoralis minor muscle, subclavius muscles and serratus anterior muscle. Let's start our today's topic with pectoralis major muscle. It is a large fan-shaped muscle of the pectoral region. It is originated by the two head, small clavicular head and the large sternocostal head. Clavicular head. It originates from the medial half of the anterior aspect of a clavicle. Sternocostal muscle from the lateral half of anterior surface of sternum, medial part of second to sixth costal cartilage, aponeurosis of external oblique muscle of abdomen. So we can see that pectoralis major muscle originate by four parts: medial half of the anterior aspect of clavicle, lateral half of anterior surface of sternum, medial part of second to sixth costal cartilage, aponeurosis of external oblique muscle of abdomen. You can also palpate all these type of muscle with your fingers for your better understanding. Let's study its insertion. It is inserted as a U-shaped tendon on the bicipital groove, lateral lip. You know where is bicipital groove is? Bicipital groove is located on the anterior surface of the humerus. It has two lip, lateral lip, medial lip, and a groove between both of these lips. So it is inserted on the lateral lip of bicipital groove. It is inserted by the two lamina, anterior lamina and the posterior lamina. Anterior lamina is formed by the clavicular fiber and the posterior lamina is formed by the sternocostal fiber. Let's see its nerve supply. It is supplied by the medial and the lateral pectoral nerve. So if you have studied brachial plexus, then you can better understand these types of nerve. Medial and the lateral pectoral nerve are the branches of brachial plexus. Let's see its action. The two head, clavicular head and sternocostal head, both have the separate action. Clavicular head helps to flex our arm and the sternocostal head adduct and medially rotate the arm. Let's see its clinical testing. On lifting the heavy rod, our clavicular head become prominent, and when we depress the rod, the sternocostal head become prominent. You can see this diagram. This diagram clearly shows how it is originate, how it is twisted, and then inserted into the lateral lip of the bicipital groove. You can see anterior surface of clavicle, medial half. That this is a clavicular head, and then from the lateral half of the sternum, second to sixth costal cartilage, is an aponeurosis of the external oblique muscle, which is mainly the muscle of abdomen region. Okay, let's move on to pectoralis minor muscle. Let's move on to the pectoralis minor muscle. It is a small triangular muscle lies deep to the pectoralis major muscle. Let's see its origin. It is originated by third, fourth, fifth rib near their costal cartilages, and it is inserted as a short, thick tendon into the medial border and the upper surface of the coracoid process of scapula. It is inserted only into the scapula's coracoid process. Nerve supply. You can see its nerve supply by the same medial and the lateral pectoral nerve. Let's see its action. It helps with the serratus anterior muscle in drawing the scapula during the punching action. You know, serratus anterior muscle is also known as the boxer's muscle, which help in the punching action. Serratus anterior muscle work with the pectoralis minor muscle. It is also an accessory muscle of respiration. It depresses the point of shoulder. You can clearly see the diagram that how it is inserted into the coracoid process, how it is originated from the third, fourth, fifth rib and their costal cartilages. Okay, let's move on to the subclavius muscle. Subclavius muscle is a round, small muscle which lies inferior to the clavicle. Now, firstly, see its origin. It's originates from the first rib at costosternal junction. You can imagine all these things, that how a muscle is originated, how a muscle is inserted. However, if you have studied earlier brachial plexus, then you can clearly identify that how branches of brachial plexus give nerves to this muscle, and so on. So, likewise, that it is inserted into the subclavian group. If you studied the clavicle, then it is inserted into the subclavian group, which is lie on the inferior surface of the clavicle. And nerve supply. For subclavius muscle, there is a separate nerve which is called as nerve to subclavius, which is a branch of the brachial plexus upper trunk. Let's see its action. It stabilizes the mainly it helps in the stabilization of the clavicle by pulling it inferiorly and the medially. You can see the diagram, that it originates from the costosternal junction, and then it is goes backward and inserted into the subclavius groove, inferior side of the clavicle. Okay, let's move on to our last muscle, serratus anterior muscle. It is a broad sheet of muscles which mainly covers the side of the thorax region. Let's see its origin. It is originated by the eight dissertation from the upper eight ribs. First dissertation from the first and second ribs, where all the dissertation from their corresponding ribs. Okay, let's see its insertion. It is inserted into the costal surface of the scapula along its medial border. You imagine all these things. What I am saying, you imagine all these things, that how a muscle is originate, how a muscle is insert. Imagine that eight dissertation from the upper eight ribs muscles are originate, and they are curve of the side of the thorax, and they're inserted into the costal surface of scapula, mainly in its medial border. Let's see its nerve supply. Its nerve supply is now to serratus anterior muscle, which is also called as the long thoracic muscle, which is the also a branch of brachial plexus. Let's see its action. Main action, it is has a powerful protector of scapula with the help of a pectoralis minor muscle, and also keep the medial border of the scapula in frame with the scapula. Medial border in frame with the chest wall. Sorry, by mistake I have written the scapula. We have to write the chest wall, and also help in the abduction of arm. The serrated anterior muscle clinical correlation is very much important, which is called a winging of scapula. If by way some injury to the long thoracic nerve to serratus anterior muscle by the stab injury, by something pointed thing, hard thing, there is an injury to the long thoracic nerve, then it will lead to the paralysis of serratus anterior muscle. If serratus anterior muscle is weakened, paralysis, then mainly it affect to the protraction of the scapula. Then the protection of scapula is weakened. Then an inferior angle in the middle border of it becomes prominent when patient pushes its hand against the pole. Let's see its nice diagram. You can see how it is originate from the upper 8 or 9 ribs, and how it is inserted into the medial border and the inferior angle of the scapula. You can clearly see the winging of scapula. See, this person have one side, you can see its middle border and the inferior angle very prominently. Other side, it is normal. So this is all about the pectoral region muscle. Thank you for watching video.